are so glad to have all of you today. And we're sorry we had to wait for quorum network so that people could not miss out.
Good morning. Good morning, all of you. I'm very grateful to be here, specifically because what is being talked about. You know, Kenya has a very interesting culture. You will be in one or the other group supporting somebody for treatment of cancer, supporting somebody for treatment of cardiovascular disease, supporting somebody, who is in hospital and has a life bill. And I'm very proud to be part of Nephros. It has grown. We have now a chapter in Machakos, that is Eastern chapter. And we have a chapter in Mount Kenya, okay? And we are hoping, as we get support, we are going to cover the whole country. We use this opportunity to thank our guests who are here with us. Dr. Shukina, you're welcome. And Dr. Shukina is our very own Dr. Sumit Talwar. Thank you. Yes, that is for you. Thank you for coming through. Really appreciate it. I also have the General Manager, International Business, Mr. Vikas. He's not only a General Manager, but a friend. Give him a hand clap. Yeah? Yeah. Thank you so much. Thank you, very grateful. Yeah. And then we have Narayan Health, Bengaluru. Yeah? Kuna maua yake hapo. Thank you. So feel at home, and we are expecting more people. So we hope that in the next few minutes we'll close. Actually, we want it to be half day, so be patient. We'll go for a tea break. Alafu wengine wakikuja tuendelee na tumalize the wonderful presentations that are here.
How do we start when we are talking about obesity? How do we start assessing this problem? First of all, we start really from assessing, from recognizing the problem. So a person needs to know what is his condition, how many kilograms, extra kilograms has. We need to know if the person has any complications, like diabetes, high blood pressure, or any other complications. So we start from assessment of body mass index. If patient's body mass index is above 30, it means the person has obesity. What is body mass index? This is your weight in kilograms divided by height in meters squared. I think everyone already know what is body mass index.
I want you to help me welcome Daktari. Please help me welcome. And make sure this flower goes with you, both of you. So here. Welcome. Thank you, Doc. Yeah. So what we're going to do, Doc, have a seat for 1 minute. Our tea is coming inside.
The main point which I would like to highlight here is the surgical approach may be considered as a non-primary alternative to treat inadequately controlled type 2 diabetes mellitus or metabolic syndrome for suitable Asian candidates with BMI of less than or equal to 27.5. So who is a surgical candidate? Any person who meets the NIH criteria or has no endocrine cause of obesity, has acceptable operative risk, and understands the surgery as well as the risks associated with it, does not have any drug or alcohol problem.
Welcome. Really appreciate it.
The understanding of what obesity is about and how to be healthy is quite serious now this year. And non-communicable diseases, they are very much addressed by the NCD group of people. and that they will be healthier. I think I will do.
Are we not giving solutions? Yes? I think now you're better equipped to even advise a friend. True or false? You can actually tell somebody with authority, now I know there is something called bariatric surgery. Yes? And it can actually help you lose weight and it is safe. You question? Are we where we were yesterday or this morning? No, we are not. So the Say No campaign believes in small steps that are effective. You go to India for treatment or you go to Nairobi, we don't care. What we care is that you don't die prematurely. So let's put our hands together and listen to our very own. The stage is yours. Thank you.
Good morning, everyone. I'm sure you're surprised. Very good morning. Classic, traditional garden variety, sleeve or a bypass may not work. That's what I want to impress upon you. And 80% or 90% of people are free of diabetes, even after 10 years. It's as safe as a gastric bypass or a sleeve or any other operation that we do. The other thing I wanted to say was a little bit about my hospital. So we are a 650-bedded hospital in South India. It's a quaternary care hospital, and my department is a super specialized department which deals with this problem of obesity. Thank you very much. Are there any questions?
So now we're going into the panel discussion, right, Daktari? But before we get to the panel discussion, I'd like us to appreciate all the doctors who've given us amazing talks. But you're going to do it in a special way. This is what you're going to do. You're going to prepare flowers, and we say 1, 2, 3, we drop. Okay? Are we together? Yes. So that the team can learn from someone space. Okay? Okay, prepare flowers, prepare 1, 2, 3, drop the flowers.
Question timer. Sindio? Natayarisha maswali yenu ikuje.
Doc, please, can you give us what are the other services that people can get at holistic living? You manage diabetic patients. What else do you do?
We are doing that what was invented again in the Eastern Europe, when the person is drinking a certain solution which is prepared, and it is cleaning the intestine from the mouth to the rectum. We have observations that the people which were having the eczema and other rashes, the patients which were having a severe asthma, after this several detoxification procedures, they improve. So it is also that what we are doing.
So you have that facility, okay? Umesikia? Tuko pamoja? Yeah. Sindio? So we are not where we were, eh? We are gaining knowledge, right?
My question is, how can these kidneys wake up without being taken inside, having surgery? Is there any medicine?
For a certain period of time, it's very unlikely that the kidneys will wake up. So you have basically two options. Either you keep going for dialysis if that's what you're comfortable with, or you go for a transplant. These are the only two options.
I know there is a gap in our health fraternity, as the two doctors have said. There is a lot of gap in patients' education. And this should happen at the first stage of kidney disease, when you are visiting your doctors in their clinic, in the management of diabetes and hypertension. Because that is the time they are progressively monitoring your kidney function tests. And that's when they should prepare you psychologically for an preemptive dialysis. and transplants. So I don't know if that would answer your question.
Now, if it comes to that, what we are talking about today, and the kidney problems are because you are obese, you will definitely benefit if you will lose the weight. That's number one. But if there is another diseases which are causing the kidney to fail, then the number one treatment is the treatment of the main disease. And then it is already that what sister is saying. If you are coming in the stage 1 and you are coming in the stage 5, that's a different outcome and different cost and different time of treatment.
I come from a family of diabetics. My grandmother died of diabetes. My mother is diabetic. My sister is critically ill right now in ICU because of diabetes. I don't want to go that way. I'm only 6 months old with the disease. I don't want to go that way. Now with that helium, something down.
Some reserve of insulin left in the pancreas, some or the other kind of surgery will help, definitely.
You talked about the relationship between diabetes and hypertension, mostly related to obesity or the overweight. We have some other people, maybe who are hypertensive, but they're not obese. How do I assist such people?
It doesn't mean that every hypertensive or every patient who has hypertension has the same reason behind it. Some patients will just have to take medicines. You can't do anything about it.
Have we learned anything?
They're all half bariatric surgeons by now.
Yeah. Let us wake up and give them a handy hard clap. Now, thank you, doctors, for being here. Thank you so much. And just like we do it in this country, can we close with a word of prayer? Oh, thank you. We could come down and close with a word of prayer. So we try to cover violence as much as possible. We wanted as many more people as possible to hear about this. What we are again saying that the doctors are here on Monday. If you want to book their clinics, now could be available.